Hi, my name is Dr. Catia Bonzano, and I'm working with Leadership Initiatives to diagnose this patient today. Um,
Okay.
may I ask her name?
Her name is Miss Unata. Safia Abdullahi.
Okay. How old is she?
She is 1 year.
What do her parents do for a living?
Me aikin ki. Her father is an electrician and the mother is a full-time housewife. She is not gainfully employed.
Okay. Does she have any siblings?
Tana da wasu 'yan uwa? Yes, no. She is the sixth of 6 children.
Okay. Can I ask what brought her in today?
Me ya kawo ta? Me ya kawo ku asibiti? Me ya same ta? Me da me da me? Me ta. She said fever,
Okay.
vomiting, and convulsion.
Okay. When did the fever start?
Yaushe zazzabin ya fara? 4 days ago.
And can you ask if it is continuous or on and off?
Yana zuwa ne ya tafi ko kuma tun da ya zo bai? It's intermittent, it comes and goes.
Okay. Can you check her fever at the moment?
Okay. Okay. Okay, we can continue before it reads. I will tell
Okay.
you the
And can you check
temperature.
her, and then after that, may you check her heart rate?
What? You said? Pardon?
After the fever, can you check her heart rate?
Okay. The temperature is 38 and the heart rate is 120 beats per minute.
Okay. Can you ask the mom if she's been feeling very weak and has low energy?
Tana da ƙarfin jiki ba. She is weak.
Okay. My initial diagnosis is malaria because of the intermittent fever and her nausea. So I would like to request a blood smear to assess her malaria. And while you're doing that, would you mind checking is her leg swollen?
Reflex. Hello?
Hello, I'm sorry, you
Can
cut
you
off.
come again, please?
Can you check if her leg is swollen or if she shows any signs of paleness?
She is not swollen. She doesn't have swollen legs.
Okay, is she pale at all?
Yes, she is.
Okay. So while you do the blood film, I would like for you to do a full blood count as well to assess her hemoglobin levels because when malaria is present, so is anemia most often.
Yes. So what do you think your diagnosis is?
Did the malaria test and the anemia test come back?
Yes. Very good. And what do you think the diagnosis is going to be?
I think she is going to have malaria and anemia.
Exactly. Correct. So what do you think your management plan will be?
Is her malaria mild or severe?
Her malaria is severe.
Okay, so I would recommend IV artesunate to try and help her malaria. And what is her hemoglobin levels?
Okay. Hemoglobin is low.
So I would recommend iron and vitamin supplements to try and increase her hemoglobin levels. So maybe she'll start feeling a little bit better.
What do you think if the hemoglobin is she has severe anemia? How
Oh,
are you
she has
going
severe
to? What do you
anemia.
think?
Then
Yes.
I would recommend parenteral therapy to
Okay.
try and treat this anemia.
Okay, that's very good. That's very good. You did very well. Amazing. I can't believe you learned all this in 2 weeks. You did very well. It's
Been
very
crammed into
commendable
our
of you
brains.
and incredible. Yes.
Okay, and
And
in
from
order,
your, how do you think you're going to, any counseling? What are you going to tell the parents, caregiver? Do you think you can counsel them on the
um, in order to prevent malaria in the future,
on the diagnosis on how to prevent? Yeah. How do
um,
you think you're going to tell them?
wait, I'm sorry,
Do
you're
you
cutting
think
me
it's
off.
necessary to counsel them on prevention of
Okay,
malaria?
so can you tell the mother that in order to prevent malaria in the future, I would recommend getting a mosquito net, covering your body so there's less skin showing, avoiding going out at night, living in a clean environment where there's not as many mosquitoes present, and there are some drugs for prevention. Then to prevent anemia, I would like her to eat foods that are high in iron, high in vitamins. She can take iron and vitamin
Yes,
supplements, and
exactly.
ultimately just to improve her nutrition.
Bravo, bravo, you did very well.